Hey, this is Eric Durek, and welcome to this edition of Med Health Fit, integrating wellness and healthcare. And this is part 2 of our program on blood labs. And if you remember the last TV show that we had on blood labs, we talked a little bit about just in general what they were and the types of blood labs that people usually have when they get a blood draw. And we talked about their importance in certain diseases like diabetes and cancer. Well, most of the information that we have from blood labs is based on my book, The Blood Lab Wellness Specialist. Now, The Blood Lab Wellness Specialist is a book that's really written for healthcare professionals, fitness trainers, physical therapists, people who are interested in knowing blood labs. But for our purposes tonight, I really want to make sure that the information that I talk about with you is generic enough that anyone who's going in for a blood lab is going to know the basics of how they work, what draws they're supposed to get, and just the relative importance of blood labs to your overall health. Remember in the last show I said that about 90% of all of the decisions that doctors make are based on the results of your blood labs. So why am I talking about this if this is really a doctor's issue? Well, over the past 10 years, it's become a public issue because people can go online and they can order blood labs themselves. A number of companies, which we'll talk about a little bit later on in the show here, are available that a person can go, they can get a blood lab test at a local lab, and those results are mailed to the company, and then it's you, the consumer, who will interact with your health coach, physician, to really interpret those labs for you under all the legal guidelines. So for the second part of the show, what I want to start off in are blood labs for cardiovascular conditions. Now, most people who are, have a family history of heart disease, people who are overweight, people who have not very good diets, are always very interested in, well, how is my heart doing? Well, let's look at a couple of these blood labs and let's find out. One of the big ones that we know of is myoglobin. Myoglobin is when you take a myoglobin test, it really is looking for damage to the heart, as is creatine kinase and cardiac troponin. Now, I'm going to talk about creatine kinase a little bit in terms of other muscle function a little bit later in this episode when we talk about sports medicine, muscle injuries, and sports medicine training. So creatine kinase or creatine monokinase are interesting blood labs in that they have a lot to do with performance. So we'll talk about that in a second. But myoglobin, if a person has very low myoglobin stores in the blood, chances are the doctor's going to recommend either a medication or iron or something that you can sort of enhance the myoglobin function. One of the other ones that is an inflammatory marker for the heart tissue is called C-reactive protein, which we also spoke about in the last episode as it relates to cancer. Now, C-reactive protein, in my estimation, is becoming one of the go-to blood components that people look at in terms of inflammation. Because one of the things that I want to impress upon the audience, both healthcare people and consumers of blood labs, is it really is inflammatory markers. In the inflammatory process, it's really one of the most important in terms of disease now, whether it's gut disease, whether it's heart disease, whether it's lung disease, etc. They have more to do with cellular inflammation than they do your cholesterol level or, in some cases, your blood sugars, etc. So these are the things that we look at, and the information on this page I received was from the website down below, which is labtestonline.org, and I'm going to mention some of these websites because they all have really good information in terms of how you should be using them. So most people know what their lipid profiles are because for the past 30 years we've been hearing it almost ad nauseum. Your cholesterol should be under 200 milligrams. Your HDL cholesterol should be greater than 40, or in some cases greater than 50. Your LDL cholesterol should be less than 100. Your VLDL cholesterol should be less than 30, and your triglycerides should be less than 150. Now, this is also from bloodlabsonline.org, and these numbers are important, but again, I'm going to really emphasize that a cholesterol level of 200, 210, even 240 these days should be interpreted not as a death sentence, but it may be something that we would look at in terms of inflammatory markers. Because I think that there are some physicians and some healthcare people who are moving away from just cholesterol as one of the main factors of heart disease to the inflammatory process. So let's move from the blood fats to the immune system. Now, remember in the last episode, we really talked about cancer tumors and some of the blood labs that you can look at, like C-reactive protein. When I get a blood lab, I always ask my physician to include an immune panel. And the immune panel may have something like the immunoglobulins, which if you have low levels of those, a person who has autoimmune disease like HIV may have very low levels of these immunoglobulins. Your white cell differential, your natural killer cells, your macrophage, your eosinophils, all of these types of white blood cells have specific and different things that they do for the body. Macrophages, I remember learning in school, was your cell eater. If you had some sort of a abnormal protein or something, the macrophage would actually engulf it and it would eat it. Natural killer cells do the same type of process, but they do it for specific types of cells, like certain types of tumor cells, cancer cells. So having a good, strong immune system with natural killer cells, macrophages, and overall white blood cells is very important, which is why I recommend to a lot of people that if you're going to get a blood test, you could look at your cardiovascular panel. That's great. You can look at your total cholesterol. They're going to do most of those lab tests on you anyway, but you might want to ask your physician or the lab company to have you look at your immune system profiles in addition to your cardiovascular profiles. Okay, well, let's say that you've got hypertension. What are you actually looking for in a blood draw? Well, you might be looking for your cholesterol. You might be looking for a urine test for kidney function, which is going to be also important. You're going to be looking at electrolytes such as sodium and potassium, which are very important in muscle function. And lastly, again, you're going to be looking for these inflammatory markers. Because a person who may have hypertension, yes, they may have some issues with their cholesterol, with their blood fats, but they may also have high levels of blood pressure due to inflammation of the vessels or inflammation of other tissues. So if we can use inflammatory markers to see what is going on in the system, then we have a better indication of how we might be able to treat it to actually lower a person's blood pressure. We also might want to look at thyroid conditions, because thyroid is so important for a person's metabolism throughout their life. And a lot of doctors are going to look at things like thyroid stimulating hormones and T4, which is thyroxine, or free thyroxine, or T3 or free T3. All of these things have different elements of a person's metabolic process and or disease state of certain tissues that produce these elements of thyroid. Well, it's produced within the thyroid, but these thyroid components. So this is also a very important test, especially in aging, when people want to see what their thyroid function is. Hypothyroidism usually has a tendency to have people become overweight, they're sluggish, they're fatigued all the time. So we can check their thyroid hormones and we can actually see what their overall level of energy is. So specific medical conditions, we're looking at things like chronic inflammation, a high sensitivity C-reactive protein, fibrinogen, which is a clotting factor, tumor necrosis factor, interleukins 1, 6, and 8. All of these things are very specialized blood tests, but they may be used sort of in a second tier when someone has some basic tests and those tests may be abnormal. They may actually go and look at some of the interleukin tests to get a better indication of what's going on within the body. With a disease like rheumatoid arthritis, which is a rheumatic disease, it's also an inflammatory disease, you might be looking at an ESR, which is called an erythrocyte sedimentation rate, or a rheumatoid factor, also looking at your inflammatory markers, and hemoglobin and hematocrit, which may be looking at the level of anemia in the body. So for someone who has rheumatoid arthritis, we're going to be looking at things, again, from an inflammatory standpoint, as well as things like here, the red blood cells, joint inflammation, etc. There's a number of different things with rheumatoid conditions. All right, one of the more interesting concepts over the last 20 years is a person's bone health, and most people will pick up a newspaper or see a segment on the news about osteoporosis. And one of the things we're looking for with osteoporosis isn't just some sort of a disease marker, but we might want to be looking at the amount of vitamins and minerals within the system that help keep those bones strong over time. And the first one I look at here is vitamin D, or vitamin D25. It measures calcium absorption within the bone. Vitamin D is one of the most important hormones/vitamins for the body because it changes with sunlight. It has many different functions. It's an anti-diabetes, anti-cancer nutrient. I'll call it a nutrient here, but also helps, like here, with calcium absorption, which is also helping bone strength. We have ionized calcium. We have a 24-hour urine excretion. Most people say, well, wait a minute, this is a show on blood labs, not on urine. Well, recently I had a blood test for an insurance policy, and not only did they require that I take 2 or 3 vials of blood, but I also give a small urine sample. And urine is very quick and easy to look at certain types of metabolites. So here we have a 24-hour urine excretion, and what we're doing here is measuring calcium output. And if you have a problem with bone loss, calcium is one of the things that you want to be looking at. We also have a TSH test, which looks at your thyroid hormones. And if you have an underactive thyroid, we want to know that too, because that's also going to be very important in bone health. And lastly, here I have a picture of a very interesting exercise machine on the bottom, and it's from a company called OsteoStrong, and it's a little franchise of studios across the country that use isometric exercise to improve bone strength. And one of the more interesting things that they do is that they measure bloods over time to look at certain types of metabolic and structural functions of the body with this exercise program. It's a brilliant idea, and they're franchising all over the country. I think probably 5-10 years from now, they're going to be some of the preeminent types of studios that people can do, that they can get the right amount of information for their bone strength just by doing the minimal amount of exercise during the course of a week. Another big thing that's in the news a lot these days is gluten sensitivity. And I can't eat certain types of breads, I can't eat certain types of baked goods, etc., because I have gluten sensitivity. Well, celiac disease, gluten issues, are an inflammatory process. They are a gut inflammation process, and we want to look at certain types of things that may exacerbate that condition. The first one is vitamin deficiencies. You may have a deficiency of vitamin A, vitamin D, or vitamin K in the system. And without those nutrients, you may succumb a little bit more to inflammatory processes. You may have bone loss, and you might not know this unless you get the right type of bone testing. And lastly, you may have certain types of antibodies like TTG that at higher levels, most people who have celiac disease, they would test, if they have this in the system at high levels, almost 100% of them will test positive for celiac disease, which is an inflammatory process. So we're looking for specific types of functions here for celiac disease that are very specific to what's going on within the body. Well, a couple minutes ago, I spoke about sports medicine. And really how I got into the whole health and medical field was from my interest in sports medicine, both as an athlete and then as a trainer and a researcher. And one of the things that I was always very fascinated with was that some athletes could compete at a very high level for a long period of time and not fatigue. And one of those athletes was a marathon runner named Frank Shorter. And Frank won the gold medal in the Olympic marathon for the United States back in 1972. And he is still the only American who's won a gold medal. And one of the things that I found fascinating about Frank Shorter is that he was not the fastest marathoner, but he had the ability to work at a very high percentage of his anaerobic threshold, which is where you convert over from using oxygen to using sugars. much, much longer than most other athletes because they tested his blood and they knew that he had one of the highest anaerobic threshold work paces of any athlete who ran marathons. But if you're looking at performance testing with athletes, you might be looking at things like aspartate aminotransferase, which breaks down hemoglobin in the blood, very important if you're running long distance races, you want to know what your hemoglobin is, or alanine aminotransferase, which breaks down creatine kinase and bilirubin in the plasma, which has a little bit more to do with high performance anaerobic type exercises. So creatine kinase, which I've spoken about earlier, is one of the big breakdown amino acids and byproducts of extreme muscle work. So the more work your muscles do, the more creatine kinase that you secrete within the bloodstream. So if you do a test for creatine kinase, you pretty much know what type of muscle damage that you're doing. And recently there were a series of articles about the exercise program called CrossFit, where they were looking at the amount of muscle damage in some of these CrossFit exercisers who went to emergency rooms, and they found very, very high levels of creatine kinase, which is indicated for the disease called rhabdomyolysis, which is a breakdown of the muscle cells that goes right into the blood. And if it gets too high, the tissue will actually die, and a person who has very high amounts of CK in the blood, they can die. And this has been a big issue with some of these high intensity exercise programs. Again, most people are familiar with lactate or lactic acid in the blood, which is tested. That's also another breakdown of muscle tissue. And anabolic agents like growth factors, beta-2 agonists, people who are on diuretics and steroids actually have issues with their blood work at different levels than people who don't, which is why after every marathon, after most sprint races in the Olympics, and after every stage of the Tour de France, most of these athletes get tested for anabolic agents right there. So if they test high for testosterone, if they test high for certain other types of metabolites in the blood, above and beyond what normal would be, they might be disqualified. So levels of creatine kinase in the system, men over 18 years of age, normal is between 50 to 330 units per liter, whereas an athlete reference range may be 200 to 600 units. Same thing for women, 38 to 176 units per liter, whereas in female athletes you may get 200 to 500 units per liter. So you actually have, as an athlete, higher circulating levels of creatine kinase anyway, depending on the type of exercise that you do. So when a person is looking for that specific type of blood test, they want to make sure that they're in the correct reference range based on their level of physical activity. So what changes does a person have with exercise? Well, normally we'll see changes in blood sugars, we'll see changes in their hormones, and we'll see changes in plasma. And plasma is important. Most people think, well, plasma is the other portion of blood. If you spin a vial in a centrifuge, the bottom part is the red blood cells and all the other components, but the clear stuff on top is the plasma. And most people think, well, that's the stuff that you really don't need. Well, remember, all of this stuff on the bottom needs to be transported in a very efficient manner, so you want to make sure you have the right amount of plasma and some of the components within the plasma that are working correctly. The other thing that you'll see with chronic exercise is changes in lipid patterns, and you'll also see changes in glycosylated hemoglobin for diabetes, which is also very important. I said in the last episode that the A1C test, the long-term measure of blood sugar, is probably the most important test that you can measure. Now, you can lower it through medication, you can lower it through diet, but here we're talking about exercise and how you can actually lower blood sugars. And if you lower them after every exercise session, in time, you'll lower the A1C. So is there a proper exercise prescription for enhancing blood sugars or most blood labs? Well, most people in exercise physiology testing will say that a good, moderately intense exercise program that's consistent is going to have the biggest effects on blood lab. If you go out once a week and do heavy exercise but sit around for the other 6 days, it might not be as effective as doing moderate intense exercise 3 or 4 times a week, it's going to have a much bigger effect on your blood sugars. So before I forget, I want people who work in blood labs already know this, but some people who are new to the blood lab area, we want to make sure that we're wearing gloves whenever we're testing home glucose. We want to make sure that we dispose of the needle and the little tab in a biohazard bag. We want to make sure that the needles go in a sharps container. And if someone's doing any type of blood lab training through their health club, through their clinic, through their hospital, mostly they're going to sign in terms of OSHA regulations. They just want to know that people have been trained on this on a regular basis. And if there's a lab safety manual in your department, make sure that all of your people at least know the basic elements of the safety issues that have to do with blood draws. Well, let's look at a couple panels here. The first one is going to be looking at reference ranges. And here we've got a nice bell-shaped curve, and right in the middle there is a healthy person. Person who's very, very low may actually be in what's called a false positive test. Person who's on the very, very high side may also be in a false positive. We want to make sure that if we're doing a blood test that it's sensitive. I mean, if you're measuring blood sugar in your home glucose monitor, that you're actually measuring blood sugar. You're not measuring cholesterol, you're not measuring something else, and that it's very sensitive to the actual measurement you're doing. So if you dab a drop of blood on there and it's 102, it should be 102. It shouldn't be 80 and it shouldn't be 160. So many, many years ago, when these machines were undergoing testing, they had blood lab ranges that was the gold standard, and then all of these machines were tested against them. And this is still done today. So whenever we look at a blood reference range, we want to make sure that it has a very high degree of what we call positive predictive value. It's telling you what it should be telling you. So if we look at something like genetic testing, and gene testing right now is real big in the United States. You can't watch TV without seeing some type of commercial on 23andMe or another gene testing company. They look at mutations, your risk for disease, risk for allergies, etc. Very interesting though, there was a company recently that looked at 5 genetic tests using the same blood samples, and they all got different ethnicities. So I still think that there is some information that needs to be the kinks need to be worked out of some of these tests that you can order, right over the telephone. It's going to be a few more years, I think, before they have a very high degree of sensitivity. In other words, if you tested all 5 of these different companies, you still should be 23% Irish, 10% Italian, et cetera, and this is not the case today. So I still think that although it's a very interesting concept, I still think there needs to be a little bit more work to be done, okay? Here we have a very interesting reference range on some antioxidants, and you can see the green dot in the middle of the scatter plots is really what they're looking for. Most of those antioxidants are above the blue line. The alpha lipoic acid is below the line, and that's one of the things that needs to be worked on in terms of they're very low in that. So there are a number of reference range points that they look at, and out of all of these, glutathione, coenzyme Q10, selenium, vitamin E, etc., vitamin C, they all fall into a good range except for the alpha lipoic acid. And that one is one that you'll need to get some sort of supplementation for. Here's another example of a range. If we look at coenzyme Q10, we can see it's actually low. It should be in the green area. It's actually on the low point. The same thing with alpha tocopherol. It's actually almost at the yellow point. And the vitamin A, second from the bottom, is also low. The one that looks right in the middle is the beta carotene. It falls right almost at the 50th percentile. And then on the right side, we see that there is the reference range, okay? So lab functions, the bell-shaped curve is very good. Here we're looking at liver function, and we can see, based on the green line to the left of the middle, that it's actually deficient. And most of these lab tests will tell you, well, it's deficient by a certain amount. In this case, 17%. So you can look at all of these types of panels and just with the cursory eye, you can see the ones with the green arrows to the right are improved, and the ones with the 2 ones on the bottom are deficient, and they can tell you by what percentage. And one of the things we look at, instead of just looking at certain blood components, we also want to look at vitamins. And here we've got antioxidants, B vitamins, minerals, essential fatty acids, and digestive support. And you can look at the range of each one of these types of things, and this gives you an absolutely fantastic viewpoint as to what types of vitamins you might be deficient in. You can talk with your healthcare provider, and they might be able to get you on some type of supplement that can be helpful in terms of that. Okay? There are also nutritional recommendations. You can look at the results of blood labs, and they can tell you, well, these are the types of foods that you might need to eat, whether it's beans, fruits, poultry and eggs, spices, vegetables, etc., that will help you with this particular deficiency. And this is also another fantastic area that you can look at actual foods that you should be eating based on the results of your blood labs. Well, this is one company that I spoke about on the show here about a year ago. This is Step One Health, and Dr. Craig Brandman, who I interviewed right here in the studio. And he has a very interesting blood lab company. You can see here that he's got the butterfly and the bicep muscle and the wheat. He's got all these types of things that he looks at here for thyroid function, cholesterol, testosterone, food allergies, and gluten sensitivity. He's got many, many types of tests that they test for. And the beauty of Step One Health is that you, the consumer, can log on. You can answer a few questions. You can talk with a health coach, and they will select the right type of blood lab that you can do right over the phone. They'll give you an order form. You take it to your local lab. You get a blood draw, and within 48 hours or so, you will get the results of that blood lab right to you. So it's really done all online. It's a fantastic type of a program. I love it. So the future of blood labs for both professionals and for the consumer. They usually offer these at a discount rate as opposed to your doctor. Many of these things are trying to refine the finger stick method. Mostly you have to do a blood draw, but you can do it with a finger stick. Patients have a learning curve. As they will increase, they're responsible for their own test. And I think that blood labs are a great step forward in terms of really taking it to the consumer. So this is the end of our blood lab program. For more information, log on to medhealthfit.com. I've got plenty more information about labs for you. If you're a health professional and want to learn more about the course, send us an email. If you're a consumer and you're wanting more information about labs, send us an email as well, and we'll try to get you set up on what we think is the best for you. So for MedHealthFit and the Blood Lab Program Part 2, this is Eric Durack. Thanks for watching.